How often do you use your brain? At this question, most people chuckle or laugh. But the fact is that we all use our brains all the time. How often do you think about your brain health proactively? Almost never. Part of the reason is because we don't have reliable tools that'll help us manage our brain health proactively. Imagine if you had a tool and reference ranges like how we do for blood pressure and cholesterol and blood sugar for brain health. We don't have the tool right now, and InMed wants to change that. My name is Latha Poonamali. I am co-founder of InMed Prognostics, and the goal of our team is to bring affordable, reliable, and data-based brain health prognostic tools to India and other emerging markets. Brain health is a worldwide epidemic. 30 million people in India alone suffer from various neurological disorders. Right now, the best case scenario for them is to get an MRI taken, and the MRI image is visually interpreted by the radiologist and the physician to come up with a diagnosis. And this method is subjective and it does not take advantage of the data analytics technologies we have at our disposal right now. And InMed offers a solution. Our solution is Neuroshield. It's a software that can take the brain images, segment it, and using data analytics and deep learning, we are developing several biomarker algorithms that will provide reports to the physicians for helping them in early detection and predictive recovery of their patients with brain health problems. And this is a disruptive product because there is no such similar product that exists in emerging markets, as well as in using the first of its kind Indian baseline data of MRI scans. So our software will look like this to the physician or the radiologist, and they can select portions of the brain images that they want to do deep dive and segment them so get clear information. And the software also, using deep learning algorithms, compares the brain images of any given patient at any given time and over time with the baseline data bank that we have built and provide useful insights in the form of a report for different conditions. For example, this is the Neuroshield epilepsy report, which takes the segmented images and develops volumetric scores, that is, the changes in the brain volume, as well as atrophy and sclerosis scores, and compares with the baseline data and provides a composite score on a 1 to 5 scale to the physician. And the physician can then use that with the reference range and also track the patient's progress over time and evolve optimal rehab and intervention plans for the patients and help their brain work better. And so this we also plan to include other conditions such as stroke and dementia and Parkinson's in the same method. And our software will also have the capacity to not only draw from the images but also other clinical diagnostic information such as EEG, psychologist report, and things like that. So our goal is to be able to make brain health just like how in other parts of the body we treat them preventatively from a prognostic perspective, whether it's blood pressure and sugar and cholesterol and all those things. So we want to be able to be the first provider who offers this to emerging markets. And we will be filling a very desperate need in countries such as India and other emerging markets. And we are very excited about our product, and I hope you are too.